This tutorial explains the process of developing the assessment matrix. The assessment matrix is a tool to diagnose the social protection situation in a country, with the objective of completing the social protection floor in that country. Here we learn the process of completing the matrix, including the inventory of social protection programs and services, identifying policy gaps and implementation challenges, and making recommendations to complete the SPF. The assessment matrix looks like this. It covers the 4 SPF guarantees: health, children, working age population, and elderly. The first column is to write down the government strategy. This is the vision or plan to extend social protection in the country. The next 2 columns are for listing the existing provisions and then the planned programs and services for the country. Following this, we identify the policy gaps and implementation issues by comparing the existing social protection provisions in a country with the SPF objectives. The last column of the matrix is to develop recommendations that address these policy gaps and implementation issues that would reach the SPF objectives. Now, let's look at how to complete the assessment matrix. We'll refer to the case study in healthcare and Corasia. For our demonstration purposes, we have modified the assessment matrix to better illustrate the process of completing the matrix. So let's begin. The first task is to figure out the government's strategy on healthcare. This can be found in the National 5-Year Plan and Corasia's case study. We then place this information in the first column labeled Government Strategy. Next, we're interested in the existing provisions. For example, these are the social health protection programs and schemes in the country. We want to list the schemes for each target group. Again, referring to the case study, we can locate this information. For example, workers in the private sector organizations of more than 10 employees are covered by the National Health Insurance Program of Corasia. Other information, such as the implementing agency, the legal framework, the number of actual beneficiaries covered, and financing sources are listed. You would then continue the process for each target group: public servants, the poor, and informal economy workers. The next column is policy gaps. Policy gaps are mainly the result of inadequate legislation or policies that lead to part of or the whole target group being excluded from the SPF. Back in the Corasia case study, we can locate this information in the social health protection for the people and the growing challenges sections. Here, the definition of the PHCP target group is inconsistent across provinces. This gap is written into the matrix. In addition, the other policy gaps from the case study. There are no reimbursement of transportation expenses under PHCP, and no access to healthcare benefits for undocumented migrant workers and refugees. And lastly, the non-affordability of SHI contributions. We now move to the next column, which is for implementation issues. Such issues arise when beneficiaries do not enjoy effective access to their entitlements due to poor enforcement of laws and schemes. For Corasia, the first issue is that the PHCP does not cover 52% of the total poor population. Other issues are an absence of comprehensive database for PHCP, and that the PHCP benefit package is not clearly defined. And there is an evasion of payment of contribution by private sector employers. The remaining policy gaps and implementation issues are then filled in. Once the gaps and implementation issues have been identified, we go to the last column of the assessment matrix, the recommendations. For this column, We define each recommendation so that it addresses these gaps and implementation issues. In Croatia, the first policy gap, which is the PHCP target group definition not being consistent throughout the country, can be converted into a recommendation to extend PHCP to informal economy workers and their dependents in all provinces in the country. The first implementation issue, that the PHCP does not cover 52% of the total target group, can be converted to a recommendation which states coverage should extend to all poor people in the country. You then continue to list recommendations for all the policy gaps and implementation issues previously listed in the respective columns. We have now concluded the tutorial on how to develop an assessment matrix. In the next tutorial, we cover how to design practical scenarios for implementation.